Hello everyone, I'm Trish O'Keefe, President of Morristown Medical Center. I am honored to celebrate another major milestone in our geriatrics program here at Morristown Medical Center with the opening of the Caregiver Training Lab, nicknamed Gerry's Apartment. This state-of-the-art facility is the newest addition of our geriatric services within the David and Joan Powell Center for Healthy Aging at Morristown Medical Center. The milestone would not have been possible without the support of the Women's Association for Morristown Medical Center, and we are deeply grateful for the recent $75,000 gift for this very important initiative. I thank every member of the Women's Association who have played a major part in this effort. Your dedication and hard work for our hospital is truly inspiring to us all. The most recent American Community Survey discovered that almost 14% of Morris County residents over the age of 65 have difficulty living independently, encountering challenges performing a routine daily living activities due to the physical, mental, and emotional condition. To address what has been dubbed the silver tsunami, our hospital has responded to this in a number of ways. Our geriatric program includes a geriatric emergency department, a geriatric assessment center, and a healthy aging program, attending to our seniors' most important needs. Dr. Kirti Sharma, our Chief of Geriatrics, will give more information and more details about these programs. Our ability to meet the needs of our aging population in a timely and effective manner has led to several accomplishments. Morristown Medical Center maintained an exemplar status in its level of geriatrics added nursing care, the highest designation achievable from Nurses Improving Care for the Healthcare System Elders, which is a national organization designed to improve the quality of care for older adults and their families. Our hospital achieved designation by continually educating its nurses and staff in geriatric treatment methods, resulting in better outcomes and actually better care. At this point, I am proud to introduce Dr. Kirti Sharma, who will discuss how we have managed these challenges while keeping focused on health and welfare of our geriatric population as one of our highest priorities at Morristown Medical Center. Thank you.
Thank you, Trish, for that kind introduction. I arrived at Morristown Medical Center in 2011, and I was hired around the same time that it was realized that there was a growing need for caring for older adults in our community. And from 2011 to where we find ourselves now, we have grown in our scope of services from having just 2 geriatricians to having 4 full-time geriatricians, 3 nurse practitioners, and 2 social workers that support our services. The heart of our service actually is the Geriatric Assessment Center, which was supported through philanthropy, through David and Joan Powell's idea that they really wanted to have some services within the community for our aging adults. And the geriatric services sit under the David and Joan Powell Center for Healthy Aging. The most crucial part of that, of course, is the Geriatric Assessment Center. And since its inception, somewhere around 2013, there has been a significant increase in our services, almost a 20% increase in the number of patients that we see annually. Beyond that, at the hospital front, of course, there is an area within the Samet emergency room, which is dedicated to taking care of older adults, and our geriatric emergency room actually has been accredited by the American College of Emergency Physicians as a level 2 geriatric emergency room. On the community front, we have the Healthy Aging Hotline, which is a hotline service available throughout northern New Jersey for older adults and for their caregivers. And it is a hotline which is literally manned Monday through Friday to support anyone in the community who may have questions about how to care for themselves or how to get the appropriate care for their aging loved one. The new Vitality program, on the other hand, within Morristown Medical Center actually is another resource that community seniors can look towards to allow them to have more of a social interaction and also community events that can support their health and well-being. Our social workers, as I had previously mentioned, are an integral part of how we provide services within the Geriatric Center, in the sense that the experience of going through medical care at our services just does not encompass that medical interaction, but also a significant portion of hand-holding and awareness of what the person's social needs are when they are in their home setting. So our social workers really are closely tied as to how these services are provided. On the hospital front, an important service which I should not forget about is our Hospital Elder Life program, which is a program which touches upon decreasing the risk of developing delirium when an older person is hospitalized at our hospital. And again, I think that too has been supported through philanthropy so far. Now, beyond our clinical care and the services we have in the community, we also take pride in the educational programs we have. Since 2016, we have a fellowship program in geriatrics at Morristown Medical Center, where we train the next generation of geriatricians, one fellow every year. But again, through philanthropy support, we have been able to expand that to 2 fellows a year, and starting 2021, we will have two physicians that we'll be training to become geriatricians. We started off as having just a training program for caregivers called a 5-part series for caregiver training, and we have expanded beyond that to actually having a caregiver training lab, which is housed within the Geriatric Assessment Center. And the intent of the caregiver training lab, which is fondly called Gerry's apartment, is to train our family caregivers as to how they can feel more well-equipped and well-trained to provide care for their aging loved one within the home setting and feel empowered through that experience. With that said, I would actually like to introduce Bev Natali, who's our Director of Clinical Services, and especially for geriatrics, so she can speak to more about the Caregiver Training Lab and also other philanthropic initiatives that we are hoping for geriatrics. Thank you so much.
Thank you, Dr. Sharma. As you can see, Morristown Medical Center recognizes the need for a multifaceted approach to improve the health and ensure the safety of a growing senior population. We are grateful to our many donors who have faithfully given to ensure that these efforts come to fruition. Let me provide some context to our new Caregiver Lab initiative. According to a report conducted by the National Alliance for Caregiving and the AARP Public Policy Institute, approximately 34 million adults, that's 14% of the U.S. population, care for a person over the age of 50. And nearly half of all caregivers provide assistance to someone over the age of 75. In Morris County alone, 22% of adults report regularly providing assistance to a friend or a family member. Approximately 84% of caregivers state that they could use more information or help with caregiving issues, especially on how to keep their loved ones safe at home. Our Geriatric Caregiver Lab, fondly called Gerry's Apartment, is one component of a much larger initiative called the Caregiver Center that we plan to develop with donor support. Please stay tuned for a video that will walk you through the highlights of the Geriatric Assessment Center, its latest developments at Gerry's Apartment, and an inside look on how our donors impact our advancements in geriatric services. Thank you, and please enjoy the video.
The Geriatric Assessment Center actually is our key service under the David and Joan Powell Center of Healthy Aging. And it is a practice which actually provides both consultative and primary care services to frail older adults. But we also see adults who are now hitting their older years, entering into the Medicare-defined 65 years of age, and hoping that they will age well and have what's called successful aging. Our program originally started with a large philanthropic donation through David and Joan Powell. And it increasingly, our expansion of our programs has been because we have had donors in the community who have supported our programs. The last few years have been very interesting, where we increasingly began to realize at Morristown Medical Center that if we just focus on our patients, we are really missing out on a segment of population that's supporting our services that we provide to our aging patients. So we started to look at the caregivers, because here are these silent partners we have in the community who are really key to how well their loved one will do. And we knew that we could just not bank on them without providing them the right type of training, the right type of support and education, so they are empowered to care for their aging parents, family members, and neighbors sometimes, and allow them to remain in the community. And in line of that, our most recent advancement here is the Caregiver Training Lab that we fondly call the Gerry's apartment, which again is a state-of-the-art mini apartment that has a bathroom area, a kitchen area, a bedroom area. Gerry's apartment has come to fruition because of a generous donation from the Women's Association, and we are really thankful to them. And our hope is that the only way we can expand our services both for our patients and our caregivers is from this continued support through philanthropy. So with that, I would actually like to bring you to a tour, because I think a picture is worth 1,000 words. Come on in.
Hi, my name is Rebecca Abinanti, and I coordinate the Healthy Aging program here at Atlantic Health. I'd love to start by giving you a tour of our Geriatric Assessment Center and later on our lab. But first, why don't we start with an exam room that's the first stop many patients see when they come in to see us. As you can see, many of our exam rooms are designed with the idea of treating our more mature population, that we have a space for families to be part of the conversation, as well as exam tables that raise and lower, so that we're able to really accommodate an older person and their family. Welcome to Gerry's apartment. Come on in. So Gerry's apartment is our Caregiver Training Lab, and it's designed to demonstrate an ideal home environment for an older person. This is our geriatric nursing mannequin that we've affectionately nicknamed Gerry. The entire lab is set up with the idea of what is a model home environment for an older person. We have a model shower with a handheld shower and some grab bars, as well as some common assistive equipment that we might find. Shower chair, toilet seat riser. We have our pet therapy dog here, Goldie, who's available to help for older patients who might be experiencing some cognitive changes. And we're looking at things how we can help keep them calm and relaxed at home. As you can see, we also have demonstrating some different types of equipment and things available for a person to help them manage in their day-to-day. A dining scarf for dignity, so that instead of having a bib or something like that, we have a dining scarf, as well as the mock kitchen environment here in the corner. As we look forward to the next steps in geriatrics, we're looking forward towards opportunities to increase caregiver education. We know that this is a growing area that we really want to focus on for our older patients and their loved ones. As we continue to grow, and with the help of other donors to help grow our geriatric programs, we hope that we'll be able to raise additional funds for our Caregiver Center for Training and Education and Support to really make this a true center for healthy aging.